A new rule out of Washington allows states to change their medical loss ratio standard. This is part of the Benefit and Payment Parameters Rule for 2019, a rule that was a long time coming out of the Centers for Medicare and Medicaid Services. It was made into a final rule on April 9th out of CMS. It's part of an annual omnibus rule, but we haven't seen one yet out of this administration. The one that was promulgated on April 9th is quite damaging to many elements of the Affordable Care Act. We're going to look just at the medical loss ratio language coming out of that rule. We'll revisit other sections of that rule in separate videos. Let's first remind ourselves what the medical loss ratio is and why it's important. It's actually a calculation. How much of your premium dollars is your insurance plan spending on claims? The Affordable Care Act made a threshold that says 80% of the money the insurance company brings in from you, they have to pay out in claims. In the days before the Affordable Care Act, insurance companies were all over the map with how much money they were taking in, how much they were saving for overhead, for commissions, for administrative expenses, for marketing, for salary bonuses. And some of the insurance companies that were struggling to hit 65% medical loss ratio, or they could barely meet 65% of the money they brought in that they could spend on claims, those were the companies that were considered to be the bad actors, the ones that weren't covering what they were committed to cover for their consumers, spending a lot instead on those other administrative costs. The Affordable Care Act came in and said, no, we need to protect our consumers from dramatic premium increases and from waste in this industry. We're going to set a threshold of 80%. 80% of what comes in must be paid out in claims. If there is less than 80% of premiums charged used for medical costs, then insurers have to issue a rebate to consumers. Now let's look at what this new rule coming out of CMS is asking us to do. The rule now allows states to request a reasonable adjustment to that 80% threshold if the state suggests that if they lower that to the 70% or 65%, like the bad old days of private insurance, if the state can show that that's going to stabilize their marketplace, the feds are going to allow it. Now, this is the language that CMS uses when they describe this adjustment to the medical loss ratio requirement. They said that it's necessary to reduce the regulatory burden in order to stabilize insurance markets. They say it's also needed to increase insurer participation and expand consumer choice. Now, we know from history that this does the opposite of stabilize the insurance market. Let's remind ourselves what was happening back in 2010, 2011, 2012, in those eras before the marketplace opened for business in 2013. As some of these provisions of the Affordable Care Act were being implemented for the very first time, Wisconsin, where we are, our Commissioner of Insurance asked feds to sidestep the medical loss ratio because he said, we're afraid that our insurance companies are going to have to either make significant cuts or lower premiums. He was afraid that insurance companies might have to charge less for their insurance product. At that time, we had 6 insurers in our state, 35% of the individual market, that could not meet that 80% medical loss ratio threshold. On the other hand, we also had some very strong participating HMOs that were exceeding the 80%. They were closer to 90% medical loss ratio, much more efficient in their operation and spending a lot of the money they brought in on claims. Our insurance commissioner was more worried about the agents and the brokers and making sure they could protect their commission instead of worrying about the consumers. It was estimated at that time that there would have to be about $14 million in rebates issued to consumers if this 80% threshold went into effect right away. And our insurance commissioner said he'd rather see that go to the insurance companies instead of to the consumers. So you could see there's a politically charged environment around medical loss ratios, and it's no surprise that this conversation is rearing its ugly head once again in the form of this April 9th rule. Now, as you can imagine, it was then the Obama administration, the feds rejected that request to sidestep medical loss ratio. We now find ourselves in a situation nationally where, because of the medical loss ratio over the last several years, the insurance market has been cleaned up. Those insurance companies that could not meet an 80% threshold, most of them went out of business. In the interim, by 2016, the insurance companies still around were paying out about $397 million in consumer rebates. They had to adjust very quickly to make sure that the consumer was being protected, and a lot of rebates were going out to ensure that. And insurance companies got more efficient. They reduced overhead expenses by 2016 by $1 billion. In 2016, the average medical loss ratio across insurance companies was 92%, better than our best performing HMOs in Wisconsin in the old days of insurance. Insurance companies have become streamlined, they're paying out more premiums and claims, and that's the way to stabilize the marketplace, not the opposite. Now, here's what this rule is doing. It's losing we're going back to the bad old days of private insurance, and we're losing progress. We're weakening medical loss ratio standards, likely allowing insurers to spend more on administrative costs and profits than claims, which we know from experience drives up premiums. You could take it right from the word of our own insurance commissioner that said if we have a higher medical loss ratio threshold, we're going to have to charge lower premiums. Now, the medical loss ratio changes risk also eroding the value of coverage to consumers. You can read the rule for yourself in its entirety. It's a long read. You can also read the CMS press release that corresponds with that. We've also shared a link here to the Health Affairs blog post, which talks about several elements included in that April 9th rule, including the medical loss ratio language. You can contact us if you want to talk about this more or visit other videos on our website. You can do all of that at healthwatchwisconsin.org. Thanks for joining us.